naturally because it's an evolving field, just like robotics. We don't know how it's going to all come together. So many times you see the wisdom of crowds influencing rather than the opinion of few. It's who puts in the data in the system and what's being interpreted out, which makes a lot of things. And coming back, coupling it with the shared decision making and how genomics, which she has opened up as a platform, something where people come and put in things. How do you mix that? So if it as a patient who doesn't have a voice, very often we think shared decision making means bringing in patients who can give a voice. I make robots for the very young. Could be neonatal, and we are also looking at surgery even before the children are born. They don't have a voice. Quite often we see babies on the table being awake during surgeries for the eye, but they can't say anything. And we know that it hurts because if you do that to the adult for a similar situation, it does cause pain in the eyes. So how do you bring that? And why does a certain disorder occur at all in the first place? For example, why do some babies have certain tears in the retina or bleeding in the retina, whereas some don't? Where is the genetics coming into play? Why does it occur in certain regions of the world where people don't have an opinion about or know about anything about? I like the fact what she said that 85% of the clinical trials, so I like the number. I'm a big fan of doing trials because we have to show what our robots can and cannot, but how do you scope them in that we don't land in the 85%, but the rest of the 15%, and how do you gather this enormous amount of data which is untapped to make it best?
So you're basically saying that for robotics also to evolve further, access to this genetic knowledge or the life-saving knowledge in general would really benefit the development of robotics.
Yes, and you need to break down barriers between, I can give you an example, even in the Netherlands, of the north, south, east, west. Forget the country barriers, the EU rules or the rules in other countries. So many barriers need to be broken down in order to make this happen.
Yeah. And speaking about tearing down barriers and increasing collaboration, I think, Paul, that's also something you're really interested in, right? Would you like to elaborate on that topic?
Actually, she already said the pharmaceutical industry is interested, and it was a really inspiring talk. And actually, I really regret we didn't met 7 years ago because as Pfizer, we were introducing a new medicine. It was for lung cancer, and as you know, lung cancer can be caused by smoking, but it can be also caused by genetic mutation. And we actually had a product that was very effective for only 2% of the lung cancer patients. So, as we call it, we were starting at our launch, we were really happy and motivated to bring it to the patients. And there we were, and we were missing patients. And we saw how effective it was. So it was really devastating that we were sitting there and couldn't find a patient. And actually there were 3 potential causes why that was happening. First of all, pulmonologists, did they know there was an innovative and really effective therapy for these kind of patients? No, maybe not. They were not asking for the genetic testing. Second of all, the genetic testing was new. Did they do it in the right way? Was the quality of the testing at the right level? And third of all, was even the product available in the hospital? That, of course, is a major challenge, and we right away discovered we can't solve this alone. We need to collaborate, and we had a dinner meeting with some pathologists in the Netherlands, and I raised my concern. And they said, yeah, we recognize this issue, and let's see how we can collaborate. And what they are doing, they are registering all the testing in the Netherlands. We have a very good cancer registry in the Netherlands, by the way. And by collecting all that data, we know what was happening in the field of genomic testing. And in the end, actually we raised the rate of testing for each patient population from 25% to 80% right now. And it's still not 100%. So again, I'm really looking forward to have a discussion with Suzanne to see how we can even make her help to really make her ambition reality, because we see especially what's necessary there.
Yeah. So lots of enthusiasm there on social genomics, I hear. Yeah. Great. I think that brings me to you, audience. Is there anyone who wants to ask something, comment something regarding the talks of Suzanne and Aart, or regarding what the panel just said? Yeah, in the back, really good. Here I come running with the mic. Woo! Cheer me up, people, cheer me up. It's far away. Come on. Give me some help here, give me some help here. Thank you. Yay! Here you go. It should be on, yeah. Yeah, it's on.
Hello. First of all, a huge thank you to the organizers for the amazing event. As for the question, it's for any of the panel members or to all of them. What do you think is the most important take-home message from today's talks? Thank you.
Great question.
Well, I think you don't go to the moon alone. So the most important message is that this region is famous for something called the triple helix. That's how they bring in industry.